you're going to write C5, C6, C7, C8, and T1. And on the top, you're going to write roots, trunks, divisions, chords, and branches. All right, if we go back one slide, we're going to end up trying to draw something that looks kind of like this. And this looks really odd and kind of confusing right now. But this is a simple diagram of this. Okay, if you can draw it out and you know how to draw the brachial plexus, then you'll know what nerve roots innervate what. And that will give you a little better understanding of peripheral nerves. Okay, so what I'm going to do is exit this PowerPoint. And so we're going to start to try to draw this. Okay, so the first thing I want you to do, and forgive me because I'm drawing this on the screen and I think this is going to go just fine, but you're going to go C5, C6, you're going to draw a triangle here, right? C5, C6 to the delineation of roots and trunks. Then you're going to take the point of that line, you're just going to draw a straight line all the way across. Very good. C7, this one's easy. You just draw a line all the way across. C8 and T1, you do the same thing you did for C5 and C6. You do a little triangle or an arrow or whatever, and then you draw a line all the way across. That's where you guys should be right now. If you're not, I'll give you a second for your page to look like this. Next, under the divisions heading between C6 and C7, you're going to draw an X. Okay, very good. Then right below that, you're going to draw a right to left diagonal line down to the C8T1 line that looks like this. Let's try that again. Let's do it like perfect. Okay, sticking with me? Now, under chords, you're going to take this top line and you're going to draw a little loopy line down under C7, C8 and end right there. Likewise, C8T1 line here, you're going to draw a line up that intersects and creates kind of an arrow with that other line. Good. If we go back to the chord section, you're going to draw a line that extends from here all the way up like this. So what you should now see is 5, 1, 2, 3, 4, 5 end lines. This one has 2 coming together. We count that as 1. And how I want you to think about this is there's an acronym that we use called MARMU. MAR, M-A-R-M-U. These are the peripheral nerves that eventually branch off and create your musculocutaneous nerve, your axillary nerve, your radial nerve, your median nerve, and your ulnar nerve. But let's do a little bit more. I'm going to change my pen color here. We'll change it to red. There are some other peripheral nerves that don't end in the hand down here. Like some of this is obviously this is the armpit area, right? But all these end these especially end in the hand, and this one ends more in the antecubital fossa area. So if we go back to here, let's draw some lines here. So go back to C5 nerve root. You're going to draw a line off of that, just up like that. Then from C5, C6, C7, you're going to draw a line that intersects with all of them. And then you're going to connect them to that line. So we go connection here, connection here, connection here. We'll get to what these are. These are all peripheral nerves that branch off of these nerve roots as well. Okay? In the trunks division, you're going to draw a line like this. That's another nerve. And then I draw a line that looks like this. In your chords division, you're going to draw a line that goes straight up. Then this next one, you're going to draw a line that goes down, up, down. And then in the bottom line here, you can draw 3 lines that go down. 1, 2, 3. And guys, this is all the peripheral nerves that branch off of this part of the brachial plexus. So how do we know what these nerves are as well? Well, let's get into it. I'll get back to my presentation to help you guys think through this. So that's where you start. Your page should look like that. If we think about what's the musculocutaneous nerve and how you get there, musculocutaneous nerve is innervated by the nerve roots of C5, C6, C7, and this is what that looks like. One thing in the divisions category, if you go back to that original, here we go, brachial plexus picture, in the divisions, there's some nerves that start to branch more anteriorly and some that branch more posteriorly. And so the one thing that we don't get a good picture of in this model that you're drawing is this division of anterior posterior. So I'm hoping that my highlights will help kind of clarify that. All right. So the musculocutaneous nerve, C5, C6, C7. If we move on down the chain, you get your axillary nerve. Axillary is more posterior, right? So you can see it diving deeper to this branch, the anterior division. The posterior division dives deeper. C5, C6, all the way out to the axillary nerve, innervated by C5, C6. Next up, we think about the radial nerve. This encompasses all of them, C5, C6, C7, C8, T1. But it all goes down eventually into the posterior direction. Right, think about where the radial nerve is in the upper arm. It's in the radial groove of the humerus, and then branches down the posterolateral elbow all the way down to the back of the thumb. So this is more of a posterior base nerve. We go to the median nerve. Median nerve is innervated by C6, C7, C8, and T1, and this is how that branches off. And then finally, the ulnar nerve, which is the easiest for nerve root reasons, is going to be C8, T1. It's just the last two, right? So if we take that and we erase all the colors, right? Here's all the colors that help you distinguish those nerves. And if we get rid of those colors, now let's start filling in the red peripheral nerves. So we already know where our endpoints are, the musculocutaneous, axillary, radial, median, ulnar, the MARMU, if you will. So if we start up here at the top left at C5, first we have the dorsal scapular nerve. If that nerve is unfamiliar to you and what it innervates, meaning what muscle that it helps send a signal to, or a group of muscles, you should look it up. I'm not going to go over the muscles that they innervate because that's a good opportunity for you to study, and then study the muscle and study the muscle action, and then some impairments that might be happening if the nerve is affected. Okay, so right under that we have the long thoracic nerve. In the trunks division, the top one is the suprascapular nerve. We've talked about that a lot in class with a suprascapular nerve palsy from like a paralabral cyst. The subclavius nerve. So your subclavius is innervated by a separate nerve. That's this nerve. If we go to the cords section here, this top one's the lateral pectoral nerve. Go down a little bit, we start with the inferior subscapular nerve. If I can spell those right, sorry, those are misspelled. And then you have the superior subscapular nerve. And then, of course, you also have, some people call this the middle subscapular nerve, but it's also known as the thoracodorsal nerve. And so that's a big one to know what that innervates as well. And then finally at the bottom here in the cords, you have your medial pectoral nerve. And then you have two nerves that help with sensation in the skin. You have your medial brachial cutaneous nerve, cutaneous meaning skin, and then your medial antebrachial cutaneous nerve. So that would just mean upper arm and lower arm skin sensation nerve. Awesome. This is what your brachial plexus chart should look like.